Both of the counseling sessions were what I expected since I've been in counseling myself, and I've been in counseling sessions with some of my own children. From my readings in chapter 8 and 9, there were several things I noticed about both counselors. They both demonstrated the skill of empathy. Simmons and others defined empathy as the acknowledgement of what a person is experiencing or feeling and the foundational reasons for those feelings so that the client feels deeply understood. They go on to state that it's considered a foundational skill for effective counselors. Knight and Sipsey, 2017, as stated in Simmons and Others, 2020, contend that when people experience negative emotions, there's a story behind their feelings. Counselors can think of empathy as a tool for helping another person tell their story and eventually move toward a more coherent narrative of their story. Calazefizute in 2020 contends that empathy is one of the most consistent outcome predictors in contemporary psychotherapy research and is particularly important for the development of a positive therapeutic relationship. Patients report positive therapeutic experiences when they feel understood, safe, and able to disclose personal information to their therapist. Both counselors in the videos demonstrated nonverbal empathy and basic attending skills in using the Solar method of sitting squarely, open posture, lean in, eye contact, and relax. They also maintained eye contact and nodded to indicate they were actively listening. They included the skill of minimal encouragers by using positive facial expressions, nodding, and using short phrases like to encourage their clients to continue in the discussion. I heard them use an open statement probe when they encouraged the client to delve deeper by saying, "Tell me more about that." Dr. Powell was particularly consistent in using the skill of paraphrasing by restating the client's narrative in his own words. I saw evidence of the skill of challenging and confrontation when Dr. Takacs pointed out a pattern of just going along with others to get along to his clients. Simmons and others in 2020 state that a counselor occasionally expresses concern about a behavior but can use a warm attitude to approach the subject in a non-judgmental way that focuses on the potentially adverse outcomes of the behavior rather than on the worth or value of the client as a person. Dr. Powell used immediacy when he pointed out that his client took a deep breath when she discussed not getting things done at work. He was able to help her put into words that she was feeling overwhelmed. I also noticed his skill of reflection of feeling when he had her discuss further her need to do things perfectly. I think Dr. Takacs used good influencing and negotiating skills to help his client see that she doesn't always need to go along with others just so that she doesn't have to be alone, but encouraged her to try to do 2 things the following week that she wanted to do and invite someone to go along with her. He followed up by goal setting with her. Both counselors exhibited warmth or unconditional positive regard. As far as noticing any demonstrations of a theoretical orientation, I believe both used an integrative approach. I think they used a person-centered approach where the counselor shows empathy and unconditional positive regard, using reflection to encourage continued exploration until the client begins to determine possible courses of action to solve their problems and begins to self-direct their lives in making better choices that lead to more effective behaviors and positive feelings, as Simmons and others in 2020 explained. I also believe they used some cognitive therapy where they helped clients evaluate their thinking and make decisions for change, also explained in Simmons and Others 2020. I think I would feel comfortable with either counselor. I would want a counselor who pointed out or challenged any unhealthy behaviors or thinking like Dr. Takacs did with his client. The question I would ask about the counseling session and the counselor is how they determine which approach to use. Is it based more upon the client, the counselor, or the issues being discussed with the client, or is it a combination of them all? Thank you.